Hello and good afternoon. My name is Daphne and I'm the coordinator for the orthodontic office of Dr. Belostoki. For the last year, we have been scanning our impressions and study models and providing patients with a VTO, in other words, a simulation process, so as to offer alternative treatment plans, not only according to the patient needs, but also to his or her wishes. The scanning of the models is done on an OrthoInsight 3D scanner, and then, using the OrthoInsight 3D software, we move the teeth to the suggested new position. If we look at this patient from the front, she has a beautiful smile. However, when she closes her lips, you can see the strain of trying to keep the lips closed. Then, if we look only at her upper profile, the relationship between the upper lip and the nose is very acceptable. Only when you see a profile of the full face can you see that there is a great discrepancy between the upper and lower jaws. But the severity of a skeletal and dental discrepancy is partially disguised by the soft tissue. The cephalometric X-ray shows how severe the skeletal and dental problem is. Can we correct this only with orthodontic treatment, or is it necessary to perform orthognatic surgery? The same 20 mm overjet looks just as bad when we look at the teeth. Not much crowding in the upper arch. Slightly more crowded in the lower arch, about 4 to 5 mm of crowding. The bite is very deep, mainly due to the over-eruption of the lower incisors. The beauty of the OrthoInsight software is that it allows us to manipulate the model and move individual teeth or groups of teeth to the position that the doctor feels they should be in order to correct the malocclusion. So the first step in treatment is intrusion of the lower incisors and malproclination to relieve lower crowding. But if we want to reduce the 20 mm overjet, we have to retract the upper incisors part of the way and procline the lower incisors part of the way. How will the change in the position of the upper and lower incisors improve the soft tissue profile of the patient? Will it be aesthetic enough to avoid jaw surgery? In order to experience the change, we have to put the teeth into the volumetric X-ray and simulate the movement of the upper teeth backward and the lower teeth forward. But what are we going to do with all the space left after we have moved the incisors to where we planned? We know that if we move the front teeth all the way back to close all the extraction space, the upper lip will move too far back and the face will have a dished-in appearance with a protruding nose. So the technical design is to use only half the space for the front teeth to move back and then pull the molar teeth forward to close the rest of the space. The facial change is acceptable without surgery even though the overjet is larger than what is regarded as normal. All upper spaces have been closed and all lower crowding relieved.